Hey Bundy, you know how cute I always think everybody is. Now we get a chance to hear from them. Hey everyone, it's your girl Lotus Lane, and I'm here with a little special bonus content. I'm with Jamey Bell, the medical director of PASS, which does the STI testing services for the adult industry. And I'm here because we needed to ask him a little bit more questions for the podcast. So
Hi,
introduce
Lotus.
yourself.
Thank you for having me.
I'm so glad you're here.
Likewise. I'm Jamey Bell, the medical director of PASS. I'm also the medical director for the Sxual Health Program at the Los Angeles LGBT Center. I'm a board certified nurse practitioner by training, and happy to answer questions.
Yes, because we definitely have a lot of medical sexual health questions that we need some clarity on. There's been a lot of new progress as far as medications go that allow people to live a little bit more sexually freely out there. So we just got done speaking with Lily Lou, who gave you nothing but praises about how you helped her get ready for her European sex trip. And she mentioned some of the medications that you gave her. So we wanted to go a little bit deeper and get the real deal info about those. One of them started with the D.
There's doxycycline, PEP. There's also PrEP, which has two different medications.
I have heard of that one,
Truvada and Descovy for PrEP.
Yeah, let's get into those. Maybe let's start with, I guess, the beginning, where you would recommend, what you would recommend first, and I guess like the deeper or more intense and involved your sexual contact, maybe let's go down the line of like, if that makes sense.
Yeah, sure. Well, I love Lily as well, and so I'm so glad that she's bringing awareness that we have these options now. So I think let's talk about HIV prevention PrEP first. So PrEP came out about 12 years ago with a medication called Truvada. It's 1 pill a day, and it's over 99% effective at preventing HIV.
Wow.
Since there's been a newer generation of that medication, which is called Descovy, they're very similar, and they both have the same effectiveness. And Truvada actually now has a generic option, which makes it very affordable for folks.
Oh, sweet.
And but oftentimes insurance will cover this medication, or there also are state programs here in California that will cover it for folks. So really anyone who wants to be on PrEP can be on PrEP.
But you have to ask about it.
Yes, you have to ask about it. Unfortunately, there still could be some, stigma out there depending where you're getting your health care. Some providers may think this is only for men who have sex with men.
Right. That's one of the things that we were discussing, is that a lot of these medications were either not as accessible to us being cis females, or they weren't even offered to us.
Yeah, which is so unfortunate. My take as a medical provider and at the LGBT Center, anyone who wants to be on PrEP and comes to us, we're going to give them PrEP.
That's good.
And, with no judgments, or, we're very sex worker welcoming. And so, anyone who feels that they may be at risk is welcome to come and see us to get on PrEP. Cool. I think also a lot of the online platforms for folks that don't live in bigger areas like Los Angeles, my understanding is they're pretty good too about prescribing PrEP to, a broader community versus,
I think one of the things that a lot of people get concerned about, especially us women, is side effects. Birth control pills have a lot of side effects, and that affect us in many different ways. And especially when you talk about taking something daily, what came to my mind first about daily prevention that a lot of us are used to is taking our daily birth control pills, if that's something that we do. So in that way, it's similar kind of action, but what might be some of the side effects people could expect on a PrEP cycle?
That's a great question. So side effects actually are very rare with PrEP. Sometimes folks will have a little kind of upset stomach, some mild diarrhea when they first start the medication.
I mean, but all hot girls, we all have a little bit of upset stomach, don't we? That stomach's always a little bit tingly.
And if you're sensitive, you take it with food. Usually if that happens, it'll go away pretty quickly as your body gets used to the medication. Now, for folks on PrEP, we monitor lab work every 3 months because it's an optional medication. So not only are we monitoring HIV and STI testing, we're monitoring kidney function. So the PrEP medications are processed primarily through the kidneys, not the liver, like other medications. So we monitor that every 3 months, and it's extremely rare to have kidney issues. But we, if we see something off, we can,
be aware of it ahead of time.
Yeah, be proactive.
Good.
So very safe, very well tolerated, and fortunately now much more accessible for folks.
I love that. I love that, especially for the sexually adventurous out there. We need to know what all of our options are.
Yes.
Because unfortunately, I think in this country, a lot of the sexual education is still stuck very much in the early 90s, in the scare tactics against HIV stigma and that kind of thing. But saying that we've had this medication for the last 12 years, we really are at a place where we can prevent even going there or even worrying about it to such a degree if more people were educated about what's available, right?
Yeah, it's amazing that we can actually prevent this now. And there's even an injectable PrEP medication.
Oh, tell us about that.
So that came out probably a little over a year ago, between 1 and 2 years ago. An injectable, which is a shot every 2 months. And it's also over 99% effective.
And where does this shot typically go on the body?
It typically goes in the butt.
Yeah, in the rear.
Part of the butt. It's been a little more challenging to get that covered through insurance. It's starting to get better the longer it's been out. But that's where things like the generic version of Truvada, we can pretty much get for anyone, very affordable, if not free.
Okay.
Yeah.
The injectable PrEP, is it still called PrEP?
Just
injectable PrEP?
Yeah, yeah. The brand name is Apretude. And there are more another injectable medicine coming out within the next year.
Oh, wow.
Is supposed to be a 6-month injectable. So we're really excited about that. We don't have a lot of details at this point. So newer, better things, keeps evolving.
Yeah, there's so many more medications and preventions out there. And one thing I've realized being in the sex industry is that sex education isn't... it's not finite, like where you just learn that one bit in 5th grade, most of us, when we're 10 years old, and you never hear anything else except for what you hear on, amongst your peers and whatnot, or what you discover on your own. And it's really great to hear this direct from a medical professional, because I think sometimes when you're one-on-one with your primary care provider that knows you, knows your family, it's really uncomfortable to ask about even just to ask about these things, because you might think, oh, they're gonna think I'm doing this or that or the other thing. But to hear this directly from you, it's really good to know what to look out for in the medical future and what's actually still available right now.
And it's so important to be comfortable talking to your medical provider and being open and honest and not fearing judgment or stigma. And so, unfortunately, I've heard some terrible cases out there, and that we're very sex positive, and it's just about keeping folks healthy.
That's good. Yeah. The thing too, I think people don't know maybe about the center, the LA LGBT Center, is that it's not just for queer folks or not just for sex workers to get help and resources from as well, right?
Yeah. Everyone is welcome to come to the center. We have primary care, we have mental health services, sexual health services that I oversee.
Cool.
It's a great place.
Okay, so I feel like you were going to say that there's a few more medications out there, so let's get into the rest of those. I don't even know the names to call them out, lay them on me.
All right. So one of the newer options out there is what's known as doxy-PEP, and that's doxycycline, which is an antibiotic, and PEP is for post-exposure prophylaxis.
Okay.
So
PEPs is like post-exposure. That's similar to like a Plan B pill, where you take after the fact if something has
absolutely.
happened. Okay.
Great comparison.
Okay.
There. It's 2 tablets of doxycycline, ideally within 24 hours after unprotected sex.
Okay.
However, studies show that it's effective up to 72 hours.
Okay. Sometimes you're hungover.
Yeah.
Sometimes you forgot.
Yeah, absolutely. And very effective at preventing chlamydia and syphilis, like high 80% effectiveness. With gonorrhea, it's about a 55% effectiveness, so it helps. But
50's better than nothing.
It is, absolutely. And the beauty of DoxyPep is you take it as needed. So it it's not taken every day. You can take it as often as a dose in a 24-hour period. But, you know, a lot of my patients kind of pick and choose depending on the situation that they had. They'll take the 2 tablets of doxycycline. Side effects, minimal again, could be some upset stomach, take with food. You know, folks worry about antibiotic resistance, using an antibiotic regularly. Fortunately, with doxycycline, we have a long history of it being used, like for acne. People will take doxycycline for weeks and months at a time for their skin. And, you know, we have kind of decades of long-term use to show that resistance hasn't been a big issue, but we still monitor for that. And obviously, it's something that we're concerned about and monitor for, but so far so good. And that initially, you know, and some providers will only prescribe it to assign male at birth. So cisgender men, trans men, trans women. The studies, we don't have a lot of data on folks assigned female at birth. We, however, will prescribe it
at the LA LGBT Center. Okay.
We, you know, believe it is equally as effective. But I just tell my patients, this is kind of what we know, what we don't know in terms of data. We know that it's safe. We know that it is most likely going to lower your risk for STIs. So I've had a lot of female-born folks from the adult industry come in to see me because they haven't been able to get it other places.
I see.
So, you know.
So that one, we're still waiting on it to be more accepted by medical professionals so they can make it more available?
Yeah, I think, you know, the studies initially were done with men who have sex with men. There was a study done in Africa with female-born folks. They did not get good data from the study. There was some issues with adherence, and so it was kind of a flawed study.
That's unfortunate.
But other studies are ongoing.
That's cool.
You know, we know it's safe, we know it's effective,
So maybe for people that aren't in LA, if they are somewhere where there is like a LGBTQ health center, they should inquire there because they're probably most likely to even have it or even know about it or make it accessible, or all of the above.
Yeah, you're absolutely right, Lotus. That's a good place to start. Some of the online prep platforms I see now are doing DoxyPep. I'm not sure, you know, in terms of you know, their protocols for prescribing, but I think that's also worth a try for people who may not have access to, you know, you know, like the resources we have here.
Okay. Were there any other new medications for sexual activity we should be aware of?
So PrEP, DoxyPep. You know, definitely recommend folks considering vaccinations for sexual health. So
that was something that me and Lily discussed too, because she said Mpox or monkeypox, as it might also be known, was something that we both had difficulty getting the vaccine for, just because of those reasons. They didn't necessarily think cisgender women were a population that should even be worried about that.
Yeah, it was so unfortunate. Fortunately, I will say the CDC did jump on then shortly after the outbreak to include sex workers in the protocol. It took a little while, and we were really pushing ahead of time to be able to offer the vaccines to folks. So Mpox or monkeypox is still out there. We're not seeing the numbers that we saw 2 years ago. It's still out there, you know, sexually transmitted, skin to skin. Unfortunately, could put someone out of work for a month or more if they have an outbreak, infection. Being vaccinated for hepatitis A and B, which are both sexually transmitted, very important. HPV vaccinations. Also.
That's kind of a newer one. So maybe sometimes when they're like mid to late 30s or older may not have been exposed to that vaccine. But do you say that it's still available for people in that age range? Because usually I've heard it's for younger people. So clear that up for us.
Yeah, so you're right. When it came out, it was FDA approved for ages 9 to 26.
Right.
Initially for female-born folks, and then they included males in the age range, and then more recently the age range was extended to 45. So between 9 and 45. Not that it won't work or that there's any reason you can't get it if you're over 45.
Yeah.
We don't know the efficacy of it. Okay. It's also often not covered by insurance if it falls outside of the approved age range. But
so yeah, if you're 44, you better get on it. You can still get vaccinated.
Yes, start it before you turn 45. And then, So, I think that's a very important one because not only is HPV vaccine preventing, genital warts, anal warts, it can prevent cancer.
Okay.
So,
all of those are very important afflictions you want to avoid at all costs.
Yeah. And we always look at, we want to minimize lost work for folks in the industry, obviously. So anything we can do, to help prevent these up front, it's just going to help in the long run, financially.
Yeah, that's great. Okay, so let me see if I got this and understand.
Yes.
So there's PEP, which is, if we're thinking like in layman's terms, the way we understand medications now, it's kind of like birth control, but for sex, as far as like you take it every day and it prevents.
For PrEP, yes.
It prevents HIV and also other STDs?
So PrEP is just for HIV.
And it's the
doxycycline PEP.
PEP.
Post-exposure.
Which is
like the Plan B.
Yes, that's the like Plan B, which is a combination of the PrEP, but it's after?
So it's the PrEP, the HIV PrEP it's an antiviral medication to prevent HIV. The PEP is an antibiotic which prevents STIs.
The rest of the STIs.
Yes.
Okay.
Yeah.
And then it's a combo. That's what I'm trying to understand to make sure I wrap my brain around it. Yes. Okay, so the after one is the combo of both for STIs and HIV prevention.
Just STIs. Yeah.
Okay.
Yeah.
Doxycycline PEP.
PEP post-exposure, and then PrEP. Pre-exposure.
Pre-exposure.
Yes,
okay, now I'm getting it.
Yeah.
Post-exposure, PEP. Pre-exposure, PrEP, before.
Exactly.
And then we got the vaccinations and everything else.
Yes. There is, we will say like for post-exposure for HIV, there is PEP for HIV exposure too.
Okay, that's what I was hoping
different. I think
we were going to get into that. Yeah.
So that's if someone has a known or possible exposure to HIV, starting a medication within 72 hours of that possible exposure can prevent getting an infection.
Okay.
So that's an option too. Sometimes folks, if they have to come and see us to get HIV PEP, will then decide, I want to go on PrEP, so then I
just to keep safe after that. Yeah.
Yeah. So we have a lot of options now.
Yeah, it seems like it. Okay, I'm sorry it took me such a minute to get my head wrapped around it, but I feel like that will be most of us out there. Yep. So one more time to review. We have PrEP, which is HIV prevention beforehand, daily medication.
Yes.
Doxycycline PEP, which is STI prevention after being exposed to possible STI. So you just had raw sex and you didn't protect yourself. Yeah. Unprotected.
Yes.
And then there is the HIV PEP. It's called that?
Yes.
Okay, and that is post-sex, unprotected sex prevention for HIV.
Yes.
Boom. And then
I get
it. And then you have all of your vaccinations for HPV, hepatitis A and B, and and maybe anything else that we need to know about?
I think that's pretty much kind of the bulk of it now.
Okay.
What we have. It's always evolving, so we'll check back at some point.
Sexual health is always evolving, so keep educating yourselves out there, people. It didn't stop in 5th grade. It definitely didn't stop in high school or college. If you are a human body that's still functioning and feeling those feelings, you should continue educating yourself because, as Jamey said, there's still more in development out there to keep us healthy and active.
Yeah. And visiting the PASS website will keep updated information. Yes,
which is passcertified.org.
If if you want my
Yeah.
socials. So on Twitter or X, I'm Jamey, JAMEYNP. On Instagram, JAMEY_NP. So I try to keep current information out there as well, or folks can reach out to me if they need help getting connected to services or have questions.
Yeah, I have to say you've been doing really great as far as like social media education and past website as well. So even if you're not someone in the sex industry, I still think it's been a very good resource for sexual information and education. So please, folks, tap in and continue to watch the podcast. Thank you for joining me with Live, Laugh, Lotus XO.
Bye.